Welcome to Great Online Training. Good morning, everyone. So this is day 2. We'll discuss in this session. We'll discuss about first step in medical coding. Means today I'll give you information about each and everything about medical coding. Okay, what types of medical codes we need to use in medical coding. What are different medical code sets that we'll discuss, and I'll also show you how to find out the code. Okay, so topics covered in this class are what is medical coding, what is RCM, and different steps involved in RCM. Then we'll see what is ICD, what is CPD, what is HCPCS, what is modifier, and lastly we'll see examples of medical coding. So what is medical coding? What do you know about medical coding? Can you tell me? Because we have discussed about it yesterday also. What do you understand about medical coding? So medical coding is the process of converting patients' health information. Health information means patient signs, symptoms, or any health related issue, any disease or syndrome, anything, and any procedure or treatment given to that patient, or any medical supplies is provided to that patient. That everything is called health information that we have to convert into alphanumeric codes. Okay, as a medical code. So medical coding is the process of converting patients' health information into alphanumeric codes, and these codes are universally accepted. Coder takes medical report from doctor, which may include a patient's condition, the doctor's diagnosis and prescription, and whatever procedures or healthcare provider perform on the patient, and turn that into a set of codes which make up a crucial part of the medical claim. Okay, so this is called medical coding. Now we'll see revenue cycle management. Revenue cycle management, also known as RCM. Okay. If you go for interview, they may ask you this question: what is RCM? What is full form of RCM? The full form of RCM is revenue cycle management. Okay. And medical coding is one of the important step in revenue cycle management. Okay, so this is diagrammatic representation of revenue cycle management. It has several steps, and medical coding is one of the steps. Each year, healthcare provider perform millions of procedures on patients, from simple checkups to complex surgeries. And to collect revenue for these services, health system must work with patients, doctors, and health insurance companies. Right? This process of revenue collection for health organization is called revenue cycle management. So basically, revenue cycle management is the process of collection of revenue for healthcare organization is called revenue cycle management. If anybody asks you about what is revenue cycle management, you can simply say that this is the cycle to collect revenue for healthcare organization. Okay? It starts with scheduling and patient's registration. Okay, then insurance verification and eligibility, medical coding, then charge capture and demographic data entry, claim submission, payment posting, account receivable and denial management, correspondence follow-up, patient phone call management, and collections. I have already explained you in simple language this RCM, how the revenue cycle management happen in India versus how revenue cycle happen in US. That I have already discussed in previous session. If you miss that session, you can get recorded session. You can go through it. Today we're going to learn about different steps in revenue. So first step is patient registration. Okay, collecting patient's demographic information, including insurance information, is called patient's registration. If any patient has any health related issue, suppose one patient has knee pain, he will call into the hospital and schedule his appointment. Okay, when he call into the hospital, the medical billing staff collect patient's demographic information, which includes insurance information also. Then they'll see, the next step is insurance verification. The healthcare providers must verify patients' insurance coverage and benefits. This involves checking the patient's insurance plan for co-pays, deductibles, and other payment details. Okay. Then actual encounter happen when patient consults healthcare provider. The details of condition and service performed is recorded either by video or audio. Okay. So after scheduling his appointment and verifying his insurance, the actual encounter happen. Patient goes to the doctor and they discuss about patient's problem. Suppose that patient has knee pain and doctor doubts that that is due to osteoporosis. Knee pain is due to osteoporosis. So doctor ordered knee X-ray. Okay, doctor ordered knee X-ray and then explain that patient about that knee X-ray and confirm the diagnosis of osteoporosis. So during this encounter, the conversation between doctor and patient is being recorded either by audio or video. Then these recordings are shared. When doctor shared that recording with insurance company. Okay, and insurance company hired so many people. Okay, medical transcriptor is one of them. So insurance provider or insurance company shared that audio or video recorded conversation between doctor and patient with that medical transcription team. Okay, then medical transcription team convert that recorded audio or video into medical script. Okay, the process of transferring voice recorded or video recorded medical reports by healthcare providers is termed as medical transcription. Okay, then medical coder comes in picture, whose job is to transform patient's condition, medical services, medical prescription into medical codes. Okay, so medical coder get that health report of that particular patient, and he read that report carefully and select necessary diagnosis from that report and what are the procedure performed. Suppose in our patient we are discussing about the knee X-ray, they perform knee X-ray. Okay, so the medical coder select procedure as a knee X-ray. Okay, and he will select code for knee X-ray. Okay, from CPT book or CPT code sheet. Plus, our patient has final diagnosis as osteoporosis of knee. Okay, so in that case, we have to select code for osteoporosis. Okay, as from ICD-10 CM code sheet. Then that medical coder assign those code for that patient's report. Then medical biller comes in picture. Okay, so next step is medical billing or charge entry. The charge entry is the process by which charges of medical services are submitted to the appropriate payers for billing. Okay, so it is the process. The medical coder assign codes for diagnosis and procedure and medical supplies. Okay, and medical biller use those codes as those codes contains some certain charges bill amount on it. So medical biller use those codes and enter those code into billing system. That process is called charge entry. Next step is the account receivables follow. This process in medical coding responsible for looking after denied or rejected claims. Sometimes some claims get rejected, okay, because of some issue in codes, some issue in insurance verification or something. Okay, so account receivable follow-up or ARs, also known as AR. Their job is to work looking after rejected or denied claims and refiling them to receive maximum reimbursement from the insurance companies. Then denial management. Next step is denial management. The process of identifying and resolving problems that lead to medical. Okay, if some coding issues are there and medical billing software encounter with that issue, The claim get denied and go back to the coder. The coder has to perform again code that report. Okay, that is called denial management. So denial coding is also one included in medical coding, where you have to work on denied claims only. Okay. The next and last step is patient follow-up and payment. The last step in process is getting paid by the insurance and insurer and the patient. So most of the amount will get paid by insurance company, and if needed, some amount patient has to be paid. Okay, so this is how RCM or revenue cycle management happen in US. Next, again, medical coding happens every time you see healthcare provider. The healthcare provider review your complaints and medical history, makes an expert assessment of what's wrong and how to treat you, and documents or record your visit. The medical coder translate that documentation into standardized codes. Okay, so these are different steps: patient registration, verification of benefits and medical necessity, then previous medical records, diagnosis, procedure, pre-existing conditions, events that occurred during encounter. Everything get recorded, and those recording are shared with medical transcriptor. Medical transcriptor listen to that recording carefully and prepare health report of that patient, and then medical coder convert that health report into medical codes. Okay, which include lab tests, also other diagnostic procedures, services, renders also. Okay, so medical codes tell the payers patient's diagnosis, treatments, services, and supplies provided to the patient. Okay, then medical necessity for treatment, services, or supplies the patient received, and any unusual circumstances or medical condition that affected these treatments and services. Okay, so sometimes suppose some procedure is going on, and if patient's BP go down, in that case, doctor has to stop that procedure. Okay, so by using modifiers, certain modifiers, we can tell the payer about that unusual circumstances. Okay. The medical coding primary use is to ensure medical billing and insurance carriers pay and process claims correct. It is also valuable for research purposes and basic medical record keeping for patients. Medical coding standardizes the language and presentation of all these elements so they can be more easily understood, tracked, and modified. So now we'll see medical coding classification system. Just give me. Okay. So under the larger umbrella of medical coding classification system, there are different categories that are used for specific purposes. For instance, diagnosis codes are used by care providers to classify diseases and symptoms, while procedure codes are used to identify surgical and medical procedures. Identifying the category that a medical coding system falls under can help you better understand its purpose and function. Okay, so we have CPT codes, ICD-10 codes, and HCPCS codes also. Okay, CPT codes we use for procedure coding, outpatient procedure coding. ICD-10 codes we use for diagnosis coding, and HCPCS codes we use for medical supplies. Okay, like injections or any ambulance service or saline or any drugs provided, we code using HCPCS codes. The main coding system used in medical coding are ICD codes. ICD means International Classification of Diseases. Okay, please remember all the code sets and their full forms and their use. Okay, because when you go for your interview, the interviewer definitely ask you about this. What is medical coding? What is RCM? Okay, sometimes they ask you about different steps involved in RCM also. Then what is ICD, what is CPT, what is HCPCS. Maybe they ask you to give some example of it also. So be aware about it. I have included all the points which are important regarding your medical coding internet. Okay. So ICD-10 codes, ICD-10 means International Classification of Diseases, describes diagnosis and medical conditions. Okay. CPT codes, CPT means current procedural terminology. Current procedural terminology describes medical procedures and services. Okay. And third code set is HCPCS codes, also known as HCPCS codes. HCPCS or HCPCS codes. So HCPCS means Healthcare Common Procedure Coding System. Healthcare Common Procedure Coding System is HCPCS. Describes non-physician services like drugs provided, saline, or injection, or ambulance service, wheelchair service, everything. Okay, other than medical procedures. So first we'll see International Classification of Diseases, ICD. This is how the ICD book looks like. You can see here 2024 because each year they publish new updated version of the book, and for examination we have to follow updated, we have to use updated version of the books, all the three books. Okay, so please remember this if you want to go for examination or even while doing your job. While doing your job, what happens? We don't need to use books. Okay, while you're working as a medical coder, you have to work on coding softwares. Okay, you will get software to select your ICDs, to select your CPTs. Okay, so those softwares are updated by your company. But if you want to go for examination, make sure that in exam these examinations are open to the book examinations. Okay, but these books are thousand and thousand pages long books. So, and you have to use these books only to while your examination. So make sure that you are using current version of the books. Okay. So this is how the ICD-10 CM book looks like. The International Classification of Diseases (ICD) codes are a set of designations used by healthcare staff to communicate diseases, symptoms, abnormal findings, and other elements of the patient's diagnosis in a way that is universally accepted by those in the medical and insurance fields. So ICD-10 CM code book consists of codes for different diseases, signs, symptoms, okay, abnormal findings and other elements. And these code sets are used universally. The current version ICD-10 CM features more than 68,000 codes. 68,000 codes. The ICD is maintained by World Health Organization. This is also important point. WHO. Okay, please make a note of it. ICD means International Classification of Diseases. Okay, and it is maintained by WHO, World Health Organization, and used across the globe with some country-specific modification. The 10th and most recent edition is known as ICD-10 CM. Okay, the most recent edition is ICD-10 CM. Previously, it was ICD-9. I remember when I started my journey as a medical coder, at that time only this transition happened. I have worked for a few months in by using ICD-9. Then after we get training about ICD-10 CM, as that is transition period when ICD-9 convert into ICD-10 CM, and both the codes are totally different from each other. ICD-9 codes are consisting only digits, whereas ICD-10 CM starts with alphabet and then followed by digits. Okay, so I have worked in both ICD-9 also and ICD-10 also. But right now, the 10th and most recent edition is ICD-10 CM. The codes will be updated every year via the ICD-10 CM and PCS Coordination and Maintenance Committee. Okay, each year in from October we have to use updated codes. Not each and every code get updated, but codes added, few codes get deleted, which are not necessary. Few codes get updated. Okay, so you have to be aware about all these updates, and you have to make sure that you are using updated. So ICD has two types: ICD-10 clinical modification, that is ICD-10 CM, included diagnosis codes for reason for encounter. Okay, so ICD-10 clinical modification, that is ICD-10 CM, includes diagnosis codes for reason for encounter. Okay, and nature of the codes are 3 to 7 alpha and numeric digits. Okay, these codes started with alphabet. Alphabet represents chapter from which that code belongs to. Okay, suppose pregnancy chapter is there, the codes will start with O. If respiratory system chapter is there, or that particular code is related to respiratory disease, code will start with letter G. Okay, so different alphabet for different chapter, followed by numeric digits, and these codes are 3 to 7 alpha and numeric. Then next type of ICD is ICD-10 procedure coding system. Don't get confused between these two. Okay, ICD-10 procedure coding system, that is ICD-10 PCS, included procedure codes for inpatient services. Okay, and nature of the code are 7 alpha or numeric digits. These ICD-10 PCS codes also and numeric digits also. In any mostly code starts with any alphabet, but after that alphabet you will find some digits also and some alphabets also. Okay, so this coding system, ICD-10 PCS coding system, is used only for inpatient coding, not for outpatient coding. And in our training session, we are not going to provide any training about this coding system. Okay. We'll just give you training on ICD-10 CM, which is used for diagnosis coding. Okay. Example of ICD-10 CM is, I'll tell you, coronary artery disease, also known as CAD, coronary artery disease, is a diagnosis, and to cure coronary artery disease, angioplasty procedure is performed. Okay. So codes used for CAD is I-25.10. This is how the ICD-10 CM codes look like. It starts with alphabet. The I is representing circulatory system diseases. Okay, so all the diseases related to circulatory system will the code starts with I. Okay, if any disease related to respiratory system, that codes will start with J. Okay, if pregnancy related diseases are there, codes will start with O. If injury related diseases are injury happens, codes will start with S. So different alphabet for different chapter. Okay, now regarding this example, we have to use code for CAD is I-25.10 from ICD-10 CM plus code used for angioplasty, which is procedure, is 047K04Z. Okay, in medical coding, we call this Z as Z. We should not say Z. We should call it as Z. Okay. So this is for dilation of right femoral artery with drug-eluting intraluminal device open approach. These codes we get from ICD-10 PCS. Okay, don't worry about it. If you want to go for outpatient coding, you will get all. If you are working in outpatient coding, you will get all reports of outpatient coding only, where you have to use ICD-10 CM for diagnosis coding, CPT code system for procedure coding plus HCPCS. Okay, and if you working in inpatient coding, okay, you will get all the reports for inpatients only, where you have to use ICD-10 CM plus ICD-10 PCS for procedure coding. You will not use CPT codes. Okay, so that you have to decide in which type of specialty you want to work. You will give interview for that particular specialty only. But just remember that if you want to go for inpatient coding, you must have knowledge about ICD-10 PCS. Okay, and ICD-10 CM is common for inpatient and outpatient. Next is current procedural terminology, CPT. CPT codes consist the wide range of services performed by physicians such as surgeries, tests and evaluations. There are approximately 10,000 CPT codes currently at use. Currently we are using 10,000 CPT codes. The CPT was adopted as a part of Centers of Medicare and Medicaid Services. This is also important point. CMS means Center for Medicare and Medicaid Services. Okay. Healthcare Common Procedure Coding System, HCPCS. This HCPCS code set is divided into two principal subsystems. So CPT is a part of HCPCS coding system, Healthcare Common Procedure Coding System. HCPCS is divided into two principal subsystems, level 1 and level 2. Level 1 of HCPCS, which is comprises the CPT. Level 1 of HCPCS is also called as CPT, whereas level 2 of HCPCS is HCPCS course. Okay, so this is how a CPT book looks like. The front page may be different, depends on different publisher, but content inside is the same. Again, updated version 2024. Make sure that you are using updated version. CPT codes are also known as level 1 codes. As just we saw, it is a part of HCPCS code, and HCPCS codes divided into two subsystems, level 1, level 2. CPT codes comes in level 1. That's why CPT codes are also known as level 1 codes. Level 1 codes are maintained by American Medical Association, AMA. ICD codes maintained by WHO, whereas CPT codes are maintained by AMA. The 5-digit numeric codes that are assigned for the following services and procedures are divided into subchapters. Like evaluation and management, we have 99 series. For anesthesia, we have 00 series. For surgery, we have 10,000 to 69,000 series. For radiology, we have 70,000 series. For pathology and laboratory, we have 80,000 series. And for medicine, we have 90,000 series. Okay. So this is how CPT codes get divided into different chapters. Okay. Surgery chapter is vast chapter. So there is also high demand for surgery medical coder also. Okay. So again, even though if you are working as an outpatient medical coder, you need to work in a certain specialty. Either you work for evaluation and management, work as an evaluation and management coder, or anesthesia coder, or surgery coder. Inside surgery also there are many subchapters. I have discussed about it while I'm telling you course content, right? So you can become a radiology medical coder, or pathology coder, or medicine coder. So there are so many options you have in this medical coding field. Apart from medical coding, also there are so many options present in US healthcare industry. So this is very good industry to start your career, I can say. Okay. So examples of CPT course like 71045 is for radiology examination, chest single view. 71046 radiology examination means X-ray, chest, 2 views. 71047 radiological examination, chest, 3 views. You can see here all the codes are same, just fifth character is different. 5 representing single view, then 6 representing 2 views, and so another category is like 71250 CT thorax without contrast, 71260 CT thorax with contrast, 71270 CT thorax with without contrast. Here fourth character is different, 5 representing without, 6 is with, and 7 representing with without. Another example is 90716 administration of varicella and chickenpox vaccines. Okay, so we have so many codes in CPT, and this is how they looks like. Next, we'll see Healthcare Common Procedure Coding System, HCPCS. This is how the book look like. You can see here they mention HCPCS level 2. HCPCS level 2 codes are alphanumeric medical procedure, okay, used for non-physician services such as ambulance services and prosthetic devices. They represent items, supplies, and non-physician services not covered by CPT codes level 1. Okay. So this HCPCS level 2 core sets contain non-physician codes for non-physician services such as ambulance services, prosthetic devices, drugs, and level 2 codes are composed of a single letter in the range from A to V followed by 4 digits. Level 2 codes are maintained by US Center for Healthcare and Medicaid Services, CMS. Okay. Example, A0021 is for ambulance service outside state per mile transport. A0290 is for injection ampicillin sodium 500 gram, 500 mg. The injection codes are depends on quantity. Okay, so we have different codes for injection, for ambulance service, for wheelchair service. All the codes you will find in HCPCS level 2 courses. Then I know that you have get confused about all the coding system. So this is to make you digest this easily. Okay, I differentiate all the code sets in one slide only. So if you go through this, that is also enough. ICD-10 CM International Classification of Diseases describes diagnosis and medical conditions maintained by the World Health Organization (WHO). ICD-10 PCS is procedure coding system describe inpatient procedure and services maintained by WHO. CPT codes current procedural terminology also known as level 2 codes describes outpatient procedure and services maintained by AMA. HCPCS codes Healthcare Common Procedure Coding System also known as level 2 codes. Okay, describes non-physician services and maintained by CMS. Okay, so ICD maintained by WHO, CPT codes maintained by AMA, and HCPCS codes maintained by CMS. We'll see modifiers. Modifiers are look like 22, 25. This is 2 alphabets, 2 digits, or 1 alphabet, 1 digits. You can see here 22, A1, 58, 76, 59, QW, RT, like this. A medical coding modifier is 2 character, numbers or digit letters appended to a CPT or HCPCS course. Okay. The modifiers provide additional information about the medical procedure, service, or supplies involved without changing the meaning of the code. Okay. So medical coding modifiers provide additional information. We have to append a modifier on procedure codes or CPT codes or HCPCS code to give additional information about medical procedure or service or any other circumstances that affect that service. Okay, medical coders use modifier to tell the story of a particular encounter. Means suppose something happened, health related happened, means BP goes down during surgery and physician has to stop the procedure. So we don't have particular CPT code for that discontinuous CPT. Okay. In that case, we have to add modifier to tell the payer that this procedure has not completed due to this reason. So particular each and every modifier describe different are used for different reasons. This is example. CPT modifiers are generally 2 digits. Okay, T3 modifier for discontinuous procedure, 76 modifier we use for repeat procedure performed by same physician on same date of service, and HCPCS level 2 modifiers are alphanumeric or have 2 letters like E1 represent upper left eyelid, TC represent technical component like this. So now the interesting part in this medical coding examples. To solve these examples, I request you to open your internet and go on to this site ICD-10 data.com. ICD-10 data.com. Okay, I'll show you. If you are using your mobile, you can just look at my screen I'll show you. This is how it looks like, ICD-10 data.com. While working as a medical coder, you may have to use this same site, or your company will provide you different software or site. Okay. So here you can see codes, index, conversion, DRG, rules, analytics, chart changes, HCPCS, license, disclaimer. Okay. So right now you can see here 2024 means this is updated. Okay. Go on this second option, index. Under the index you have four options: ICD-10 CM index, ICD-10 CM external cause index, table of drugs, table of how to use each and everything that we'll discuss in further sessions. Okay, right now we just need to find out some ICDs. So we have to go on this first option, ICD-10 CM index. Okay, so this is how index look like. It is typically okay. So our first example is chest pain. First, we need to search code for chest pain. So right now here condition is pain, right? So we have to always go by condition while searching for ICDs. So here condition is pain, so we have to search in Peter and filter this list. We have to put down here pain. All the pains here get highlighted with the yellow color. So we need this first one, and inside the pain we have to search for chest. Okay? As the chest is the location of that pain, we have to follow this first line. You can see here 1, 2, 3 lines, right? We have to follow the first line to search for pain. Yes, inside the pain or under the under the chest term, you can find different terms also or different locations also. Atypical, ischemic, musculoskeletal, non-cardiac. But in our example, we don't have any specification, so we need to choose the default code. Default code means the code present right after the, here it is R07.9. So our code will be R07.9. Okay. Next, we'll search code for abdominal colic. Again, we have to go on alphabetic index and we have to search for, here colic is the condition, we have to go by colic. Okay, and abdominal colic. So we have first term only abdomen. So to click here, our code will be R10.83. Next, gallstones. Again, we have to go on index and we'll see whether we can find directly gallstone. Yes, we have term, but you can see here there is no code given. Okay, this says see also calculus gallbladder. If you are using book, you have to follow the instruction. You have to turn the pages and go on C term and C alphabet and search for calculus there. And then under the calculus, you have to go on gallbladder to search gallbladder. Okay. But right now, as we are using the site, once we click here, it will directly lead us to the calculus. Okay. We don't need to turn the pages. That's why it is very easy to search using site or any application. Or under the calculus, they ask us to look for gallbladder. Okay, so we got our code. We don't have any specification gallbladder with bile duct calculus or something. So we need to choose this code K80.20. Next, Crohn's disease of small intestine with fistula. We go by disease first. Okay, we need this first term. Okay, under the disease we have to search for Crohn's on the first line. You can do Control F also. If you press Control F, you can search any term on that particular page. So I'll do the same. Okay. When I go on Crohn's term under the disease, it says that see enteritis regional. So I click here. Now I'm in enteritis term and I'm on the regional. Enteritis regional. We have Crohn's disease of small intestine, right? So we have to search for, under the regional, we have to search for small intestine. We have code for large intestine. Now we have to follow this second line, okay? Because on the first line we selected regional. Now under the regional we have to follow the second line and search for small intestine because our location is small intestine. We got small intestine, but we have more specification that Crohn's disease is with fistula also. So again we have to follow this third line which has fistula. So our code will be K50.013, which is for Crohn's disease of small intestine with fistula. Next and last is pressure ulcer of right hip, stage 3. Again, we have to start our searching. Pressure ulcer, we have to search for U-term type ulcer. Oh, sorry. Okay. We have to search for pressure. Here we found pressure term on the first line. And under the pressure, we have to search for our location, right hip. So we got hip here. Okay. But they told that stage 3 pressure ulcer is there. So better to go by stage. You can see here stage 1, stage 2, stage 3. So on the second line, we search for stage. And under the stage, we have to follow the third line and search for hip. Okay. So L89, you can see here. If you directly go on pressure ulcer hip, you can find different steps of stages also. You can go by either ways. So our hip is right hip, right? So you can see that ulcer of unspecified hip, ulcer of right hip, left hip. So now we need code for pressure ulcer of right hip, stage 3. So L89213 is our. This is how you have to search ICDs. You can try by yourself. This is very interesting part. Next, I'll show you one example. Okay, how the report looks like. This is how you have to go through your report. You will get reports of the patient. First, you will see indication, then procedure, description of procedure, and lastly, you will see post-operative diagnosis, or sometimes we call it as. So here, indication is a 40-year-old male with rectal pain, rectal bleeding, and some left-sided lower abdominal pain. Here I have highlighted these terms, the problems that patient is facing, rectal pain, rectal bleeding, because I may need to search code for this if any diagnosis is not confirmed in impression. Okay, that's why I have highlighted this term, and you have to do the same thing if you are going for examination. Okay, then procedure performance colonoscopy. This is description of the procedure, and in impression it mentioned that moderate size internal hemorrhoids are there and mild diverticulosis. So here in this example, diagnosis is confirmed that these sign and symptoms, the patient's sign and symptoms like rectal pain, abdominal pain, these all are caused because of internal hemorrhoids and diverticulosis. So here in this scenario, we have to search code for internal hemorrhoids and diverticulosis only. Okay, there is no need to code these sign and symptoms because these sign and symptoms are part of these diseases. Okay, plus we have to search code for colonoscopy also, as this procedure is performed. So CPT code we use for colonoscopy is 45378 colonoscopy, and ICD-10 CM code will search ICD-10 CM code using the ICD-10 CM. First we'll search code for hemorrhoid. We need to go here. I hope you are enjoying searching the codes. Okay, we have to select the term hemorrhoids, and or hemorrhoids are internal hemorrhoids. Okay. Yes, this straightforward code. On the first line, we found internal, and directly we got the code K64.8. In other hemorrhoids or internal, you can see here applicable to internal hemorrhoids without mention of degree. Okay, approximate synonyms you can refer. Internal hemorrhoids. Next, we'll search code for diverticulosis of large intestine with bleeding. Okay, again we have to go on D term, search for diverticulosis of large intestine with bleeding, right? So we have to search on the first line large intestine and on the second line with bleeding. Okay, so we got our code diverticulosis of large intestine without perforation or abscess but with bleeding. Your code will be K57. This is how you have to find out the ICD codes. I hope you are enjoying. Try to search these codes by yourself. Okay. Thank you for attention. Thank you for attending this session. If you want to learn more about medical coding, if you want to enroll for our medical coding course, okay, any basic medical coding course or advanced medical coding course, you register yourself on this mobile number, or you can go on this site www.greatonlinetraining.com and register yourself. And if you have any query, you can call us on this number 9966956770. Okay. Once again, thank you. Bye bye. Take care.